or pathologically occurring fluorophore. We can say alternatively that it is a topographic metabolic mapping of lipofuscin in the RP. These are different modalities, mainly two types, fundus camera-based autofluorescence and SLO-based autofluorescence. Because of these differences like wavelength, field of view, SLO-based autofluorescence is more sharper and well-defined than other autofluorescence. So in findings, we get like a fluorescent angiogram, black or white. For white, it is due to increase or hyperautofluorescence, and hyperautofluorescence can be because of excessive RP lipofuscin accumulation, lack of absorbing material, optic nerve head drusen, and in artifacts too. These are few examples of excessive RP lipofuscin accumulation, like in ARMD and lipofuscinopathies, like Stargardt disease, Best dystrophy, Best adult vitaliform dystrophy. In lack of absorbing material, may be due to depletion of luteal pigment or displacement of luteal pigment, like macular telangiectasia, macular hole, and cystoid macular edema. And where we can get black, that means hypo or reduced autofluorescence, can be because of reduction in RP lipofuscin density or increased RP melanin content, and examples are geographic atrophy and other retinal dystrophies. So in a nutshell, hyperautofluorescence are due to increased lipofuscin, decreased luteal pigment or choroidal vessel under RP, and hypoautofluorescence are due to absence or reduction of lipofuscin, loss of RP, and increased RP melanin content. This video is from our imaging, our center imaging room. This is normal mood with parameter. Then this is the green filter with its parameter. And now the blue light, that means autofluorescence mode with its parameter. So before going to abnormal, how a normal autofluorescence look like? This is the picture of a homogeneous background of normal autofluorescence. Now the main focus, clinical applications. It is indicated in some cases of ARMD, retinal dystrophies, some retinal and choroidal diseases, drug toxicity, and optic disc head drusen. In case of ARMD, there may be a variable autofluorescence, but mainly hyperautofluorescence over RP degenerations. In geographic atrophy, where there is RP loss, there may be a hypoautofluorescence, but interestingly, in ages or in junctional zone, there is hyperautofluorescence. From fundus autofluorescence, we can assume the prognosis also. In geographic atrophy, the rim of autofluorescent pattern has a prognostic value. And from this pattern of autofluorescence, we can judge that some patterns have rapid progresses and bad prognosis. Sometimes RP rip can occur in ARMD patients. So where there is ripped area, there may be increased hypoautofluorescence. This is the vitaliform stage of Best disease. There may be a hyperautofluorescence due to lipofuscin material occupying the entire vitaliform space. This is the pseudo-hypofine stage where lipofuscin material gravitates inferiorly. This is the Stargardt disease, mainly hypoautofluorescence. This is the typical picture of cone dystrophy, where central zone is of atrophy. The finding is hypoautofluorescence, and surrounding rod ring is hyperautofluorescence. This is fundus albipunctatus. Serpiginous choroidopathy is an inflammatory pathology where we can get hypoautofluorescence, but according to disease activity, ages or a junctional zone may be hyperautofluorescence. This picture of mutes, optic disc head drusen. So the take-home message is fundus autofluorescence is inexpensive, rapid, and non-invasive imaging technique. It provides information. In some cases, it provides information over and above other conventional retinal imaging. Thank you.
Thank you, Dr. Arup. Now, on this topic, Dr. Mohammad Munurijaman will say something.
Thank you, Arup. Actually, in 1995, it was actually first introduced this Fundus Autofluorescence. And 2000 সালের কাছাকাছি সময় থেকে আমরা এই বিভিন্ন সেমিনার সিম্পোজিয়ামে এই ফান্ডাস অটোফ্লুরেন্সেন্স বিভিন্ন এটার যে অ্যাপ্লিকেশন এটা সম্বন্ধে আমরা শুনেছি জেনেছি। সমস্যাটা হচ্ছে কি যে ফান্ডাস অটোফ্লুরেন্সেন্স ইটস এ ভেরি গুড টুল ফর হুইচ ডিজিজেস ডিজিজ বেসিক্যালি আরপি রিলেটেড ফ্যাক্ট এবং যেগুলি ফান্ডাস ডিস্ট্রফি যেগুলি রেটিনাল ডিস্ট্রফি ম্যাকুলার ডিস্ট্রফি এবং ড্রাই